Well, good evening and welcome to the COVID-19 update. I'm Kayode Okikiolu. Here are the highlights. The National Agency for Food, Drug Administration and Control, NAFDAC, approves Pfizer vaccine for emergency use in Nigeria. Ekiti State Government embarks on sensitization program to avoid increased infections and more misconceptions. And we're still keeping our eyes on India, where yet another record numbers of infections were recorded as capital Delhi runs out of spaces for cremation. Well, another weekend is upon us, and while you may be firming up those plans for the weekend, do keep in mind that disregard for COVID-19 preventive measures puts you and everyone around you at risk of getting infected. And the actions you take to limit the risk of the spread of COVID-19 protects the vulnerable around you, as our fight against COVID-19 remains a collective effort. Now, that's a note of caution from Nigeria's lead public health institute, the NCDC, as it announced 62 new infections in the last 24 hours. Let's break the figures down for you.
Nigeria has recorded 62 new cases of COVID-19 in 10 states across the nation. The states are Lagos with 38 cases, Kaduna and Ondo with 6 each, Akwa Ibom, the FCT and Rivers State with 2, and the states with the least number are Edo, Kano and Oyo with 1 each. The new infections have raised the cumulative count to 165,055 infections across the country. No death was recorded in the last 24 hours, leaving the total loss of life at 2,063. 20 people have been discharged after testing negative to the virus, raising the total number of recovered persons to 155,041. More than 1.9 million samples have been tested, and close to 8,000 people are fighting the coronavirus disease. In the latest report from the National Primary Healthcare Development Agency, over 1.1 million eligible Nigerians had been vaccinated with the first dose of the AstraZeneca vaccine, corresponding to 59.2% of the target population. Lagos has given over 230,000 vaccines, corresponding to about 91% of the target population. But Kwara has reached over 112% of its target population with just over 31,000 jabs. South Africa is the only African nation with well over 1 million confirmed cases of COVID-19. Morocco comes second with over 500,000 cases, and Tunisia is third with more than 300,000 cases. Tanzania, Liberia, and Guinea-Bissau have the lowest number of cases in Africa, with less than 4,000 each. The global cumulative COVID-19 count is now over 150 million. There have been over 87 million recoveries and more than 3 million deaths.
And all, NAFDAC has approved the Pfizer COVID-19 vaccine for use in Nigeria. The Director General of the agency, Professor Mojisola Adeyeye, announced this during a virtual briefing at the agency's headquarters, with a caveat that the approval is only for emergency and not total use. She explains that NAFDAC can review the approval if analysis of the data gathered from its usage shows the need to do so. The Pfizer-BioNTech COVID mRNA vaccine is a 2-dose jab said to have over 90% efficacy against symptomatic SARS-CoV-2 infection. Well, we'll bring you more on that in a moment, but let's head over to Ekiti State, where the Ministry of Health has been responding to claims that the COVID-19 vaccine might also have an effect on the malaria parasite, as it says no research has been done in that area. The focus of the state government for now is how to intensify sensitization of people in the state following the emergence of a third wave of COVID-19 in some countries. Our correspondent, Babajide Agbeyo, gives us an update from Ekiti State.
Good evening. The Ekiti State Ministry of Health says it has no evidence yet to back claims that COVID-19 vaccines have some effects on malaria or its treatment. The commissioner in charge of the ministry says the state hasn't carried out any research along that line as of now. The state government has, however, advised residents not to undermine COVID-19 or take unnecessary risk at this time, even as the third wave of the pandemic is being reported in some countries.
We've done fairly well in ensuring that we get as many people as possible on the vaccine. We were probably one of the first 2 states to complete the doses given to us by MPHCDA. We will be getting some more soon, and we hope to be able to administer to as many people as possible. We can see what is happening globally around the world. India, for instance, is having a 3rd wave. Canada is having something similar, France as well. And so I'll continue to encourage people that we should not let our guards down. Continue to wear your face mask, continue to use your sanitizers, and maintain social distancing.
Meanwhile, some survivors of COVID-19 around here have been sharing their experiences. This is in furtherance of the state government's effort to let people know that the pandemic has been real after all, and that the time hasn't come yet to let down the guards. Babajide Agbeyo for COVID-19 update.
Well, let's bring you more on our lead story. Now that NAFDAC has approved the Pfizer-BioNTech vaccine for emergency use, you may be wondering, what are the implications? Well, Dr. Ikiala Ishaku is a virologist and public health epidemiologist. He joins us on the program virtually. Well, it's great to have you on the COVID-19 update. First, let me ask you, what does this emergency use approval by NAFDAC entail, really?
What it entails is that it is an indication that there is a global vaccine shortage, and so we need to close the gaps to see that we do not miss out in the accessibility of the vaccines. Secondly, the vaccines, the emergency use is to actually curtail what we public health modelists have envisaged, the 3rd wave. So the emergency use in place is to prevent the third wave in Nigeria, as we can see from Brazil, from India, and other parts of Asia. The approval of Pfizer is in right direction. This is because it is one of the best COVID, 95% efficacy, more than virtually all other 6 approved COVID-19 vaccine. So the approval, what we shall be seeing in the coming days is that there will be decrease in community transmission, decrease in hospitalization rates, and also that will mimic or stop the 3rd wave experience in Nigeria.
But you know, the NAFDAC DG said emphatically that, well, for now, this is going to be for emergency use and not total use. So you say that, I mean, moving forward, it might reduce infections, but this is for emergency use. So is it any different from what we're doing currently with the AstraZeneca vaccine?
Absolutely. You know that the Pfizer vaccine has lesser side effect. No blood clotting has been experienced. There are more cases. There are reports of adverse side effect or adverse reaction as a result of AstraZeneca Oxford vaccine. The coming in of Pfizer vaccine is in the right direction for emergency use. This is because I think they don't want, the NAFDAC DG doesn't want to open up, but definitely there is a vaccine shortage in the country. Globally, there is a vaccine shortage. And so if we get a Pfizer vaccine to augment the AstraZeneca vaccine, that will go a long way to also help Nigeria in curtailing the COVID-19 viral in pandemic or the spread of the disease. Secondly, too, that will actually decrease hospitalization, just like the way I said before. It will also decrease community transmission, and it will in short wave. So I strongly believe that it is in the right direction. It is for emergency use because we have a global vaccine shortage. We need to augment, we need to close the gap in terms of accessibility, and then even in terms of vaccine uptake by the general population. So we are doing this in the right direction so that we can be able to close the gap in terms of vaccine shortage.
I mean, that's saying that, I mean, the WHO had given it the EUL as far back as December. But let's talk about the elephant in the room. Do you see any challenge with storage now that the Pfizer-BioNTech company says that new data demonstrate that their vaccine can be stored at temperatures of -25 to -15 degrees Celsius, and that's compared with AstraZeneca, which of course you can still use normal refrigeration for the storage. So for this Pfizer vaccine, what are the challenges you see with storage?
Yeah, some of the challenges that actually we shall be facing as a country, we don't need to play politics with this, is that we shall be facing challenges of storage, which is normal in a resource-constrained setting like Nigeria, like in other developing countries and other developing nations. So yes, I agree with you that we'll be facing challenges of storage. And I believe that even before the approval, NAFDAC would have, and National Primary Healthcare would have put in modalities on ground on storage. But I think that at every point in time, we need to do what is called a time series point analysis of these vaccines. You will agree with me that last week, South Africa and Malawi destroyed the Oxford's AstraZeneca vaccine because at a point in time, they did analysis and they discovered that it has lost its efficacy. So what I will encourage NAFDAC to do is to open a window for research to actually do a time point series analysis, even at a point of administration of these vaccines. We need to also get a platform where we can get feedback from people that have adverse side effects as a result of uptake of the Pfizer vaccines. So we shall be getting challenges of storage, which is normal in resource-constrained setting, but I will encourage that we do vaccine efficacy tests to actually establish that.
Okay, just on a final note now, now that you're saying we need to close the gaps further, which other vaccines would you advise Nigeria to be looking at? I know there's talks about Johnson & Johnson, now Pfizer. Which other options are available for Nigeria, really?
The options that are available in Nigeria is for us to have a local content development. We need to actually look inwards. The only option is for us to have the political will. We have the human resources on ground. We need a presidential vaccine initiative. I want to see to how the presidential task force committee now and the press, not only for COVID, but for this. We need to start producing vaccines.
Well,
in-house.
Doctor,
it is quite key. This is timely so that we don't lose hope of this in the nearest.
Well, Dr. Kiala Shaku, we really did push our luck with the connection there, but we'd like to thank you so much for joining us on the program. Dr. Kiala Shaku is a virologist and a public health epidemiologist.
Thank you.
Well, let's head over to Adamawa State, where thousands of vulnerable households, in fact, this time in Katsina first, they expected to benefit from grains provided by the National Emergency Management Agency as the state government commences the 5th phase of palliative distribution across the 34 local government areas in the state. While flagging off the distribution exercise at the state grain store in Malumfashi local government area of the state, the Speaker of the House of Assembly in the state, Tasiu Zango, mandated those saddled with the responsibility of distributing the items to ensure that they get to the targeted beneficiaries.
We sent samples, but most of them came out negative. And the sad thing is that we report positive, we don't report negative. And initially, there was a concern raised that we should be reporting out of 100 how many are positive among the samples we sent. So that is why you don't hear of positive results. But when we get 6-2, the response system, which the agency is also a very key partner in, and that's why our primary healthcare facilities, the DSN and LGS, we must give kudos to them that they are doing very well. So the response is working in Adamawa State. That is why we are not getting the positive results in large number. However, as we do more testing, the best way is we test everybody, but we don't have the resources. The technology is very expensive and we cannot apply to everybody, and that is why we use some criteria-based testing for us to be able to have a headway.
When COVID-19 update returns, the moment will bring you an update from Europe and, of course, India. to join us again. Well, welcome back. I haven't brought you an update from Adamawa. Let's now bring you some from Katsina State, where over 135 households have so far benefited from the palliatives in each of the local government areas in the state. And now, thousands more are expected to benefit from grains provided by the National Emergency Management Agency through the state government.
National Emergency Management Agency, NEMA. This is the second phase of the NEMA distribution. But in the series of distribution of palliatives by Katsina State government since the start of the COVID-19, this is the fifth phase of the distribution. The first one was in August 2020, immediately after the lockdown. The state government distributed 50% of the palliatives provided by COVID. After some time, when the remaining balance of the palliatives were provided, the second phase was also given out to the vulnerable households. And as promised by the president, when the palliatives provided by the federal government was released through NEMA, it was also distributed in phases. That was the third phase. Another distribution of palliatives was done, the one provided by the Victim Support Fund under the chairmanship of T.Y. Danjuma. And this one we are witnessing today is the fifth one that we are distributing.
And outside Nigeria, Europe has been battling a third wave of infections, but there are signs that the continent is reaching an inflection point. DW correspondent Chelsea Delaney joins us from Berlin for more on this. Chelsea, Germany's infection rate has fallen to its lowest level in 2 weeks as the country remains in a lockdown. Tell us, has the third wave finally been broken?
Well, the numbers are clearly trending down. We've seen the rate of infection per 100,000 residents falling all week, and today it's sitting just above 150. We've seen already health officials, though, warning not to read too much into this. The health minister, Jens Spahn, said yesterday that this is a good sign, but 2 to 3 days doesn't make a trend. So they want to see a more prolonged decline in the level of infections. And for now, they do remain quite high. Today, the government agency reported about 25,000 new infections, and they still are indicating that hospitals, healthcare systems remain quite strained. So while we are seeing the number of infections start to stagnate, to stabilize, many health officials say it's too early to start talking about lifting some of these restrictions that have been in place since November. They want to see a more sustained decline in the level of infections.
So I'm looking at the vaccination campaigns, and they're showing clear signs of acceleration. And that's after the chaotic start that we saw. 1 million people vaccinated in a single day this week. So the question is, can you keep up this momentum?
Well, after a very difficult start, the German vaccination campaign is certainly starting to rev up. They did vaccinate about 1.1 million people on Wednesday, and there seem to be two factors really driving this. One is that the supply situation has really improved here in Europe. At the beginning of the vaccination campaign, all European countries were really struggling with the shortage of vaccines, in part because AstraZeneca had really fallen behind on the levels of deliveries that they had promised to the EU. We've seen Pfizer and BioNTech really step into the fold, and this week the EU announced a deal for 1.3 billion doses of this vaccine. So that is helping to increase the level of supply. But the other thing that's really helping to accelerate the vaccination campaign here is that general practitioners are now starting to give vaccines as well. So on this day, on Wednesday, when they gave 1.1 million vaccines, about a third of those were coming from general practitioners. So this is starting to really supercharge the vaccine campaign, but there's still a lot of work to do. Only about a fourth of Germans have received their first dose, and for some high-risk groups, like those over 70, the vaccination rates still remain quite low.
So looking at the trends, does this mean that travel to and from Europe could restart by the summer?
Well, this is a topic that's being discussed all over Europe right now. Many European countries are quite desperate to get travelers back. The EU receives about 10% of its GDP from tourism. In some countries like Greece and Spain, that number is much higher. So there are a lot of countries that are very much dependent on the return of a summer travel season. We've seen the EU take some steps on this topic. Earlier this week, Ursula von der Leyen, the head of the EU, indicated that American travelers will be able to come to Europe this summer if they've been vaccinated. There are still some logistical things that need to get worked out about how exactly they would accept these vaccine certificates, but they've opened the door for the return of these travelers. The other outstanding question is whether Europeans will be able to travel once they've been vaccinated. The EU has really pinned its hopes on basically a vaccine certificate. They're calling it a digital green certificate, but this would be a digital certificate that shows whether you've been vaccinated, whether you've tested negative for the virus, or whether you've had the virus and recovered. And they want this to be used to allow for people here in Europe to travel without quarantines, without other restrictions. So the EU has agreed on this. The EU Parliament actually passed it yesterday.
Well, thank you very much, Chelsea. She joined us from Berlin. Let's head over to India, where yet another record daily rise in coronavirus cases was recorded as hospitals across the country run out of beds and oxygen. Officials in Delhi have also been urged to find more sites for cremations, as the city's morgues and crematoriums are overwhelmed by COVID deaths.
Another day, another world record number of daily infections, as thousands of Indians search frantically for hospital beds and life-saving oxygen for sick relatives. India reported over 380,000 new cases in the past 24 hours, while deaths from COVID-19 jumped by 3,498. However, medical experts believe actual COVID-19 numbers may be 5 to 10 times greater than the official tally. The situation is so critical that hospital beds that become available, especially in intensive care units, are snapped up in minutes.
Any fever, sister?
No, sir. Crematoriums are also overwhelmed with the influx of bodies, with some cremated in makeshift pyres in parks and parking lots. Amid the record surge of cases, a group of dentists in Mumbai have joined the frontline battle to treat COVID-19 patients.
We are the most experienced. If at this point of time we run away from the field and a new person comes, they may not be able to handle it that well.
All vaccination centres in India's financial capital of Mumbai have been shut for 3 days due to a shortage of vaccines. India is the world's biggest producer of vaccines, but does not have enough stockpiles to keep up with the second deadly COVID-19 wave. Only about 9% of India's 1.4 billion people have received a vaccine dose since January. In the meantime, help has been trickling in. The first US plane carrying more than 400 oxygen cylinders and other hospital equipment and nearly 1 million rapid coronavirus test kits has landed at New Delhi's International Airport. The US has also redirected its own order of AstraZeneca supplies to India to allow it to make more than 20 million doses. India has also received shipments from other countries, including United Kingdom, the UAE, Thailand, Romania and Ireland.
Well, don't forget to protect yourself, especially during your weekend activities. The virus is still very much out there, so continue to take responsibility. And visit our websites, channelstv.com, for more updates and better understanding of the pandemic. We also have all the big stories from politics to business, sports, and so much more, all at your fingertips. Well, that's the COVID-19 updates. Thank you for watching. I'm Kayode Okikulu.